QC Microbiologist Interview Masterclass. Welcome to this PharmaTalks career course, designed to help you answer technical pharmaceutical microbiology interview questions with clarity, evidence, and confidence. In this masterclass, we will work through 45 practical questions across 5 focus sections, from core microbiology and environmental monitoring to investigations and behavioral scenarios. Follow PharmaTalks and explore the rest of the course for more cleanroom and pharmaceutical quality training. Leave a comment below if you would like the presentation, the related interview file, and details about our complete collection of educational resources and courses. Section 1. Pharmaceutical Microbiology Fundamentals. This section establishes the technical foundation expected from a QC microbiologist. We will connect routine laboratory responsibilities with recovery science, media controls, method suitability, and valid test execution. Focus on explaining both what the laboratory does and why each control protects product quality. Question number 1. What are the primary responsibilities of a QC microbiologist? Execute compendial and validated microbiological tests under approved procedures. Monitor cleanrooms, utilities, raw materials and process samples and finished products. Review data, investigate excursions, trend results, and support product impact decisions. Maintain qualified equipment, media controls, documentation, training, and inspection readiness. Question number 2. How do bioburden and sterility testing differ? Bioburden estimates viable microorganisms before sterilization or in non-sterile products. Sterility testing assesses absence of detectable viable organisms in a defined sample. Bioburden is quantitative, sterility testing is qualitative and probabilistic. Each test requires product-specific method suitability and contamination controls. Question number 3. What is viable versus non-viable contamination? Viable contamination can reproduce and form colonies under suitable conditions. Non-viable particles cannot grow but may carry microorganisms or affect product quality. Microbial methods measure recoverable organisms, particle counters measure physical particles. Both data streams should be interpreted together with process and intervention context. Question number 4. What does CFU mean and what are its limitations? A colony-forming unit represents one recoverable organism or microbial aggregate. One colony may arise from multiple cells, so CFU is not an exact cell count. Recovery depends on sampling stress, media, incubation, and organism physiology. Report CFU with method, volume or area, dilution, and detection limit context. Question number 5. Which factors affect microbial recovery? Sampling method, collection efficiency, surface properties, and organism desiccation stress. Media composition, neutralizers, incubation temperature, duration, and atmosphere. Product antimicrobial activity, filtration efficiency, dilution, and analyst technique. Holding time and transport conditions can materially change recoverable counts. Question number 6. What is the purpose of growth promotion testing? Demonstrate each media lot supports growth of low levels of relevant microorganisms. Verify nutritive properties after preparation, sterilization, storage, and transport. Use controlled inocula, positive controls, and acceptance criteria from approved procedures. Investigate failures before media release or use in reportable testing. Question number 7. How do you select challenge organisms for GPT? Include compendial strains specified for the medium and intended test. Add facility or product isolates when risk and recovery history justify them. Match organism type to media selectivity, incubation conditions, and intended detection. Control passage history, inoculum level, identity, purity, and preparation traceability. Question number 8. What is method suitability and why is it required? It proves the product does not inhibit detection under the proposed test conditions. Evaluate neutralization, dilution, filtration, rinsing, and organism recovery. Use representative product, low-level challenge organisms, and appropriate controls. Complete suitability before routine testing and reassess after meaningful method changes. Question number 9. Which controls should accompany a microbiological test? Negative controls detect contamination from media, diluent, apparatus, or technique. Positive controls verify growth support and expected test system performance. Method controls challenge neutralization, recovery, filtration, or product interference. Environmental and equipment status must also support validity of the run. Section 2. Environmental monitoring and cleanroom control. This section moves from laboratory fundamentals into contamination control inside classified areas. We will discuss risk-based monitoring, representative locations, sampling methods, excursions, and meaningful alert and action levels. Strong interview answers should connect each monitoring choice to exposed product and process risk. Question number 10. How would you develop a risk-based environmental monitoring program? Map process flow, personnel movement, exposed product, utilities, and contamination pathways. Use classification, airflow visualization, interventions, and historical data to rank risk. Define sites, methods, frequencies, sample volumes, limits, and recovery conditions. Periodically reassess using trends, changes, deviations, and contamination control strategy. Question number 11. How do you select environmental monitoring locations? Target points nearest exposed sterile product in critical aseptic manipulations. Include high-touch surfaces, transfer routes, airflow boundaries, and difficult-to-clean areas. Use smoke studies and intervention mapping to identify representative worst-case sites. Document rationale and ensure sampling does not compromise first air or operations. Question number 12. Compare active air, settle plates, contact plates, and swabs. Active air samples a measured air volume onto media for CFU per cubic meter. Settle plates passively collect fallout over time but do not measure air volume. Contact plates sample flat surfaces, swabs access irregular or hard-to-reach surfaces. Method choice depends on risk, geometry, recovery, timing, and operational impact. Question number 13. What are the limitations of settle plates? Recovery depends on particle settling velocity, airflow, exposure time, and plate position. They do not detect small suspended particles efficiently or provide volumetric concentration. Media can desiccate during long exposure and handling may introduce contamination. Use them as complementary continuous monitoring, not a substitute for active air sampling. Question number 14. How do you prevent an air sampler from disrupting grade of first air? Position equipment based on airflow studies and approved sampling diagrams. Avoid blocking unidirectional airflow between HEPA source and critical surfaces. Use low-profile, qualified equipment with disinfected components and controlled tubing. Confirm placement during dynamic smoke studies and train operators on aseptic setup. Question number 15. What context should be recorded with an M sample? Location, method, volume or area, time, duration, batch and room status. Operator, intervention, equipment state, cleaning status and nearby activities. Media lot, incubator conditions, sampler identity and calibration status. Any anomaly, delay, airflow disturbance or procedural deviation affecting interpretation. Question number 16. How would you investigate a grade A M excursion? Immediately protect product, notify stakeholders, preserve evidence and document conditions. Review interventions, personnel monitoring, airflow, alarms, cleaning and adjacent results. Identify the isolate to an appropriate level and compare with historical flora. Assess batch impact scientifically, define root cause, CAPA and effectiveness checks. Question number 17. What is the difference between alert and action levels? Alert levels signal drift and trigger heightened review before loss of control. Action levels indicate potential control failure and require formal investigation. Limits should reflect regulation, classification, method capability, and facility performance. Any grade A growth deserves careful evaluation even below a numerical threshold. Question number 18. How would you establish or revise alert levels? Use sufficient clean historical data stratified by room, site, method, and state. Evaluate distributions, recovery frequency, seasonality, and meaningful shifts over time. Avoid relying only on averages because microbiological data are often zero-inflated. Document statistical and scientific rationale, then periodically review performance. Section 3. Laboratory methods, validation, and data integrity. This section covers compendial testing, alternative methods, validation, and reliable records. The goal is to show that method performance and data integrity are inseparable. Explain how controls, equivalence studies, audit trails, and documented review create defensible microbiological results. Question number 19. What are the major steps in a sterility test? Verify sample plan, method suitability, media status, equipment, and aseptic conditions. Filter or directly inoculate the required quantities using validated procedures. Incubate specified media under defined temperatures and durations with controls. Inspect, document, investigate any growth, and complete independent data review. Question number 20. When is membrane filtration preferred over direct inoculation? Use filtration for filterable products and larger volumes when antimicrobial removal is needed. Rinsing the membrane can reduce product inhibition and improve organism recovery. Direct inoculation suits non-filterable products or limited sample quantities. Selection must be justified through compendial requirements and method suitability. Question number 21. How do you investigate a positive sterility test? Secure the test, preserve isolates and records, and notify quality immediately. Review aseptic manipulations, facility monitoring, controls, equipment, media, and analyst history. Compare isolate identity with product, personnel, environment, and laboratory flora. Invalidate only with clear evidence of laboratory error, otherwise assess batch impact. Question number 22. What variables matter in disinfectant efficacy testing? Surface material, soil load, organism type, inoculum, contact time, and concentration. Application method, temperature, water quality, preparation age, and storage conditions. Use representative facility isolates and resistant spores where risk warrants. Validate neutralization and recovery so residual disinfectant does not bias results. Question number 23. Why is neutralization required? Residual disinfectant or product preservative may continue killing during recovery. Neutralization separates true contact time efficacy from post-sampling antimicrobial carryover. Demonstrate neutralizer effectiveness and absence of neutralizer toxicity. Include controls that prove challenged organisms remain recoverable after neutralization. Question number 24. Which characteristics validate an alternative microbiological method? Specificity, detection capability, precision, robustness, and range as applicable. Accuracy or equivalence versus the compendial reference under relevant matrices. System suitability, false positive and false negative rates and data integrity. Predefine acceptance criteria and maintain lifecycle control after implementation. Question number 25. How do you demonstrate equivalence for a rapid method? Use paired samples or controlled challenges across representative organisms and matrices. Compare detection probability, recovery, precision, specificity, and time to result. Include stressed, low-level, and environmental isolates near the decision threshold. Analyze statistically and scientifically. Investigate discordant results before approval. Question number 26. What does ALCOA plus mean in microbiology data? Data must be attributable, legible, contemporaneous, original, and accurate. Plus complete, consistent, enduring, and available throughout the retention period. Apply principles to plates, worksheets, instrument files, photographs, and metadata. Audit trails, access controls, review, and controlled corrections protect reliability. Question number 27. What would you do after finding an undocumented correction? Preserve the record and immediately notify the responsible supervisor or quality. Determine who changed what, when, why, and whether original data remain available. Assess scope across related records, results, systems, and potential product impact. Correct through approved procedures and address training or systemic control gaps. Section 4. Deviations, investigations, and risk assessment. This section focuses on decisions made when results challenge the state of control. We will distinguish OOS and OOT events, preserve evidence, use identification intelligently, assess product impact, and design effective CAPA. Interviewers are looking for scientific independence and disciplined risk assessment. Question number 28. How do you approach an OOS microbiological result? Confirm immediate containment and perform a timely, independent laboratory assessment. Review calculations, sample handling, controls, media, equipment, incubation, and technique. Do not retest into compliance. Define scientifically justified testing before execution. If no assignable laboratory cause exists, expand to manufacturing and product impact. Question number 29. How does OOS differ from OOT? OOS violates an approved specification or acceptance criterion. OOT remains within specification but deviates from expected historical behavior. Both require documented evaluation proportional to risk and potential product impact. Trending detects deterioration before formal specification failure occurs. Question number 30. How do you distinguish laboratory error from manufacturing contamination? Seek direct evidence such as failed controls, equipment malfunction, or documented technique error. Compare isolate identity and timing with laboratory, personnel, facility, and process flora. Review sample chain, duplicate patterns, M results, interventions, and batch history. A hypothesis alone is insufficient to invalidate an unfavorable result. Question number 31. What evidence should be preserved before cleaning? Secure plates, isolates, photographs, instrument files, audit trails, and worksheets. Record room state, equipment setup, sampler placement, interventions, and personnel present. Collect justified confirmatory samples without disturbing the original scene unnecessarily. Maintain chain of custody and contemporaneous documentation for all evidence. Question number 32. How does microbial identification support an investigation? It links or differentiates product, personnel, environment, water, and laboratory sources. Species level or strain level resolution should match the investigation question and risk. Use identification with recovery timing, location, phenotype, and historical trends. Never treat an identification match alone as proof of causation. Question number 33. What does repeated recovery of one organism suggest? A persistent niche, ineffective cleaning, resistant biofilm, or recurring personnel source. Map recovery by site, time, shift, equipment, and operational condition. Review disinfectant susceptibility, material compatibility, drainage, and inaccessible surfaces. Escalate remediation and verify effectiveness with targeted intensified monitoring. Question number 34. How do you assess whether an organism is objectionable? Consider product route, patient population, dose, and ability to survive or proliferate. Evaluate virulence, resistance, toxin potential, and history in product-related infections. Assess manufacturing controls, water association, preservative system, and product characteristics. Document a multidisciplinary, risk-based conclusion rather than using a fixed list alone. Question number 35. How do you assess product impact after an M excursion? Define exposure window, affected batches, locations, interventions, and barrier integrity. Evaluate organism identity, level, proximity, airflow, duration, and process stage. Integrate sterility assurance controls, personnel results, utilities, and historical trends. Document uncertainty, rationale, disposition recommendation, and required follow-up. Question number 36. Give an example of CAPA for a recurring M trend. Root cause, recurring mold near a transfer airlock during humid conditions. Corrective action, deep clean, replace damaged seal and remediate hidden moisture. Preventive action, humidity alarms, revised inspection frequency, and targeted staff training. Effectiveness, define no recurrence period plus trend review at high-risk sites. Section 5. Behavioral and scenario-based questions. This section tests how you apply technical knowledge under pressure. Use concise examples, transparent escalation, and patient-focused decisions. Where appropriate, structure personal examples with the situation, task, action, and measurable result. Question number 37. Describe a time you identified risk before product impact. Define the trend or weak signal and why it mattered. Explain your data review, risk assessment, and timely stakeholder escalation. Describe containment and preventive action implemented before a batch failure. Quantify the outcome, avoided exposure, improved control, or reduced recurrence. Question number 38. How would you handle disagreement with an investigation conclusion? State the scientific concern calmly and reference specific evidence or procedural requirements. Ask what evidence would disprove each competing hypothesis. Escalate through the quality system if patient or data integrity risk remains. Support the final documented decision while preserving an honest technical record. Question number 39. What if manufacturing asks you to invalidate an unfavorable result without evidence? Decline respectfully and explain that invalidation requires a demonstrated assignable cause. Preserve data, document the request, and continue the approved investigation. Notify QC leadership or quality according to escalation procedures. Keep decisions independent of schedule or batch release pressure. Question number 40. What if an operator touches a non-critical surface during an aseptic intervention? Stop or stabilize the intervention without creating additional risk. Have the operator follow approved glove disinfection or replacement procedures. Document the event and obtain targeted personnel or environmental samples if justified. Assess proximity, first air disruption, exposed product duration, and batch impact. Question number 41. How do you prioritize multiple deviations with competing deadlines? Rank by patient risk, sterile product exposure, regulatory commitment, and evidence perishability. Contain high-risk events first and preserve time-sensitive samples or system data. Set owners, decision milestones, and transparent communication with stakeholders. Document justified extensions, never trade investigation quality for administrative closure. Question number 42. How do you explain a complex investigation to a non-technical manager? Lead with the decision, product risk, and what is known versus uncertain. Use a simple timeline, source map, and 2 or 3 decisive data points. Translate technical terms into operational consequences and clear choices. End with recommended actions, owners, deadlines, and residual risk. Question number 43. What if an incubator has a temperature excursion? Quarantine affected results and verify alarm, probe, calibration, and excursion duration. Assess actual temperature profile against organism recovery and method requirements. Review growth controls, media, sample stage, and available stability evidence. Document scientific impact. Repeat only when justified and authorized. Question number 44. What if a required M sample was missed during manufacturing? Document the deviation immediately. Do not fabricate or backdate a sample. Determine why it was missed and whether an alternative data source is meaningful. Assess process exposure, adjacent M, personnel data, interventions, and batch risk. Implement corrective action and strengthen controls against recurrence. Question number 45. Which metrics evaluate a QC microbiology laboratory? Write first time rate, investigation recurrence, cycle time, and on-time completion. M excursion rate, recovery frequency. Adverse trends and organism recurrence. Invalid test rate, media control failures, equipment downtime, and backlog age. CAPA effectiveness, audit observations, training performance, and data integrity signals.